Hello, I'm Abhay Singhal, founder of the mental well-being platform Detox and the psychological testing software PsyPack. The UGC has just released new guidelines on a uniform policy on mental health and well-being for higher educational institutions, and this is not a suggestion, it is a mandate. This policy is the direct result of a landmark Supreme Court judgment in July 2025, which recognized that student mental health is absolutely central to institutional excellence. The court didn't just identify a problem. It mandated a solution, forcing a fundamental shift in how we approach student welfare. This framework is built on the UMMEED principles, which guide us to understand, motivate, manage, empathize, empower, and develop a holistic ecosystem of support that aligns with our National Education Policy 2020 goals. We must now move from acknowledging the student mental health crisis to implementing this mandatory comprehensive solution. So let's look at the concrete infrastructure every institution is now required to build. The mandate requires every institution to establish a dedicated, visible, and accessible mental health and well-being center. This center must be a physical hub, not just a virtual office, with private spaces for confidential sessions and proper documentation systems. Beyond the physical space, you must staff it with qualified professionals at a mandatory ratio. One mental health professional for every 500 students. This includes professionals like psychiatrists, clinical psychologists, and psychiatric social workers. You also need a trained faculty mentor for every 500 students to ensure early identification of at-risk students. This is about building a professional infrastructure that can handle the complexity of student mental health needs. This infrastructure is the foundation for the 3-tier support system we must now activate. The policy's strength lies in its 3-tier support system, ensuring students can access help through multiple trusted channels. Tier 1 is professional support, delivered by your qualified mental health staff who provide assessment, counseling, and crisis intervention. Tier 2 is faculty support, which involves trained faculty mentors who act as crucial gatekeepers, providing early identification and referral. And Tier 3 is peer support, where trained student mentors, at a ratio of 1 to every 100 students, foster a sense of belonging and provide essential peer-to-peer support. What makes this system so effective is the clear referral pathway and communication protocol that seamlessly integrates all 3 tiers. This ensures that a student who starts with a peer can be smoothly escalated to a professional if their needs require it. But even the best support system is useless if students can't reach it during a crisis. We've established the 3-tier support system, but we must now address the most critical component: how we handle emergencies. This policy provides a comprehensive framework for suicide prevention and crisis response, moving us from reactive measures to proactive safety planning. Prevention starts with systematic risk assessment, which means we must actively screen students to identify those at elevated risk of self-harm before a crisis even occurs. When an emergency does happen, institutions must have a trained crisis response team with clear practice protocols for immediate intervention, including safety planning and de-escalation. Post-crisis support is equally vital. We must ensure students receive psychological first aid, counseling, and a clear reintegration plan to prevent recurrence. This framework is about saving lives and supporting recovery, ensuring we have a coordinated response when it matters most. Now let's look at the practical steps for putting these systems in place. Moving from policy to practice requires a clear, phased approach, and this timeline gives us the mandatory structure. The first 3 months are foundational. You must establish the dedicated mental health center, hire the required professionals, and form the monitoring committee. The next 3 months, phase 2, focus on infrastructure by setting up the 24/7 helpline, creating all necessary protocols, and crucially, training your faculty and peer supporters. By the end of 9 months, in phase 3, you must fully launch all awareness programs and activate the support services, beginning systematic data collection. This is a rapid mandatory rollout, and success hinges on institutional leadership committing adequate funding and ensuring staff receive proper training. This isn't a suggestion. It's a clear roadmap for compliance. But implementation is only half the battle. We must also ensure continuous accountability. We can't improve what we don't measure, which is why accountability is built directly into this framework through the MANAS-SETU portal. Every institution must use this portal for regular reporting on implementation status, incidents, and outcomes. This requires systematic, anonymized data collection on service utilization and crisis incidents, which the UGC will review annually. The goal is to track tangible outcomes, not just activity. We are looking for improvement in student mental health, a reduction in attrition, and most critically, the prevention of loss of life. This is not about compliance theatre. It's about continuous improvement, ensuring we learn what works and scale it across the entire higher education system. This commitment to data-driven accountability ensures that the Supreme Court's mandate translates into real, measurable change for our students. We've established the UGC framework demands a robust infrastructure and a significant increase in qualified staff. The challenge for institutions is how to build this complex system quickly and compliantly. This is where our practice management software, Detox, and our clinical software, PsyPack, provide the integrated solution. Detox offers the digital backbone for your mental health center, handling everything from student intake and consent, booking and scheduling, to helplines, crisis protocols, customized training modules, and centralized compliance reporting for the MANAS-SETU portal. PsyPack provides the clinical tools your professionals need, including over 100 standardized assessments, like the PHQ-9 and GAD-7, complete with automatic scoring and detailed reports. We even solved the staffing challenge by offering a hybrid model. You can onboard your internal team onto our platform, and if required, you can tap into a pool of vetted psychologists and counselors. We are actively working with multiple IITs and private universities to implement this infrastructure, ensuring they meet the UGC's mandate for professional staffing and secure data collection. This is how we move from policy to practice, creating a scalable, compliant, and high-quality care system for every student. You can reach out to me on the email given on the slide.